Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is concluent, makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the stress of daily work life, we are now facing hair problems in a very younger age now. It is not uncommon now to see 25 to 35-year-old people complaining about hair problems. Most of the hair problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Abyramy. He is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD, and practicing medicine for over many years now. She's dermatology, trichology, and cosmetology. Currently, she's practicing as an associate professor at Kavita Medical College and also practicing at her own clinic, cosmetic hair transplant and skin clinic, Kodambakkam, Chennai. I'm so sorry, I'm pronouncing wrong.
That's
Dr.
good.
Abhyam has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient awareness about hair care and skin care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are gonna talk about like hair care kind of scenario, and whenever we talk about hair care in this era, the very common problem which we are all facing is hair loss. So can you please enlighten with your profound experience, like what's normal and when to be concerned for?
So hair fall as such is a normal because everyone shed hair. But what is abnormal and normal is in a normal day you shed 50 to 100 hair, and the day you shampoo your hair you can even shed up to 200, which is completely normal. And also hair fall, which is a seasonal hair fall or a hair fall that happens after stress, trauma, or a medical illness, pregnancy, all these are completely normal. When you find a bald patch or you see your hairline is receding than the normal hairline, or you see a patchy hair loss, or your scalp becomes visible, that is when we call it as a abnormal hair loss.
Okay, so when the patches are prominent and hair is everywhere, that means something
Yeah.
is wrong. Okay, that's very interesting, doctor. So, doctor, now that we know that it is okay, but when it is not okay, then we should go to the doctor. But then people are quite confused, like what are those actual causes? Because people keep blaming themselves why it is happening to me. So, can you please let us know, like what are those general causes of hair loss?
As I said, the natural process of hair loss that
Mm-hmm.
happens as 50 to 100 hair or up to 200 on the day you shampoo.
Mm-hmm.
Pathological can be genetic. Genetic is the one cause which causes a baldness pattern where your hairline recedes, or in female they see the partition line widening. That is a
Mm-hmm.
genetic pattern which requires a long-term treatment. As our gene is the culprit and our hormonal pattern is the culprit, your treatment
Mm-hmm.
also has to be a long-term one or till you want to maintain the hair as you want. And there are
Mm-hmm.
other pathological causes, which is a immunological, where patient gets a patchy hair loss, where the treatment approach is completely different. And there are reasons like immunological conditions, autoimmune disorders, and connective tissue disorders, where correcting that problem is essential. Apart
Mm-hmm.
from that, it can be seasonal, it can be associated with nutritional deficiency. So, what we do when a patient comes, especially young children, come with no pattern hair loss, we do their blood workups to see if they have any nutritional deficiency or a thyroid disorder. If that
Mm-hmm.
is there, that has to be corrected. So, what generally patients or people tend to do is when there is a hair loss, they tend to follow any advice they get or whatever they see. First, you have to identify why you get that hair loss, and then we
Mm-hmm.
have to work on it.
Okay, so identification is necessary to get a medical treatment. Okay. And that's very informative, doctor. So, doctor, nowadays we all are living a lifestyle which is like quite busy, and we don't even get time to sleep, and we eat whatever is available to us. So, can a person lifestyle play a role in hair loss?
100%. You worry that you have a hair fall, your stress will worsen your hair fall and goes as a cycle. So stress
Mhm.
is a major culprit. You require adequate sleep. In females especially, we see PCOS as a common problem nowadays, where
Mhm.
the hormonal imbalance can be controlled 50 to 75% by a active exercise and maintaining your body weight itself. And also habits. You say you have a genetic pattern of hair loss, but a person who smokes or takes alcohol will develop it earlier than the person who maintains the healthy lifestyle. So it accelerates the problem. So definitely maintaining a good lifestyle is the most important factor. And the balanced diet also plays a huge role in your hair loss.
Okay, that's so even the lifestyle is important for the hair health. That's very enlightening, doctor. So, doctor, nowadays we are hearing one word called nutraceuticals, which is available like everywhere, and people are like quite confused, like what is this? So, what is the role of this nutraceutical in hair health?
That's what I said. Taking unnecessary nutraceutical extra doses, especially micronutrients, you see this B12 gummies and biotin gummies and all this when you take unnecessarily extra, it goes off in urine. And excess
Mhm.
nutraceutical also is very harmful. So
Mhm.
required amount is what is required, which usually is, we do have that in our balanced Indian diet itself. So if
Mhm.
we do the blood workup, we find you're deficient in certain nutrients, especially iron, vitamin B12,
Mhm.
ferritin in this, then we do the corrective treatment according to the RDA or according to the deficiency patient has.
Mhm. Okay. Okay.
So
Okay.
blind nutraceutical is not essential, but when we
Mhm.
correct any hair problem, we want a hair to be stronger. So for
Mhm.
that, we need the proper nutrient supplement. So based on the deficiency we have to correct, there's no blind correction of nutrients.
So, doctor, is it like that is these nutrients should be taken as per gender RD requirement under the supervision of doctors? Is this like that?
Yeah, definitely. You have to go with based on the RDA requirements.
Okay, okay, okay. Okay, doctor. So, doctor, now we have talked about hair loss and we have talked about lifestyle. Another very common problem which is faced by all of us is like dandruff. So, can dandruff also lead to hair fall?
Dandruff per se doesn't lead to hair fall, but
Mm-hmm.
when it's a persistent problem, you try to comb vigorously, you try to
Our doctor may have some glitch. She will join in a minute.
Sorry, I think there was some connection error.
Yeah, no problem, doctor. So
Yeah.
we were talking about dandruff, and
And
we were talking about can dandruff also lead to hair fall?
yeah.
Yeah.
So yeah, dandruff per se doesn't cause hair fall, but
Mm-hmm.
when the treatment for dandruff sometimes can, and there can be acute hair fall, which is due to the inflammation, skin inflammation per
Mm-hmm.
se, which is caused secondary to the dandruff.
Okay. 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 So, doctor,
Hair
we were
transplant.
talking. Yeah.
Yeah.
So, uh, okay. So we were talking about like when when person loses the like there are so many treatment options available and people get confused like what is the right treatment for them. So what are those medical treatment options available for hair loss, like surgical or non-surgical or any other treatment?
So yeah, coming to the first, I have to identify the cause. As I said, you say you
Mm-hmm.
have nutritional deficiency, then the treatment has to be correction of nutritional deficiency. Have a
Mm-hmm.
thyroid issue, correction of that. If it is due to stress induced that. If it is a patterned hair loss, then comes
Mm-hmm.
multimodal treatment, where in an early stage, which is a baldness pattern type in male or female, it can occur. So in those types, the treatment can be medical when it's a very early stage of hair loss.
Mm-hmm.
If it is a little advanced, we stage it from 1 to 6. So if it's around mid 2 to 4, we combine treatments like PRP or growth factors when the
Mm-hmm.
patient have follicles. But you want a treatment at an area in an advanced stage where the follicles are not there, or you want to improve the hairline, then it has
Mm-hmm.
to be surgical, which is a hair transplant.
Okay. 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 So, doctor, can you please elaborate, like, because when people loses all the hair, they get like, and they are, and none of the medical treatment options is working on them, then they think about hair plants and transplant, and then they get scared that is this procedure is safe? What is this? So, can you please enlighten us today with this platform?
It's a completely safe procedure if done by the right person. So,
Oh,
who's
yeah.
the right person is dermatologist, board certified dermatologist, or a plastic surgeon with MCH degree. They are the
Okay.
people who are trained to do this and who knows in and out about skin and hair. As a
Mm-hmm.
procedure, probably anyone get trained, but then you
Mm-hmm.
should know which suits which patient and what to evaluate medically and
Mm-hmm.
what are the
Okay.
complications to expect. So when in a right patient, when it's done under proper medical guidance at a
Mm-hmm.
hygienic place, which everything takes part, there it is completely safe, a minimally invasive procedure where patient does not require any hospital admission or any IV therapy. Nothing. We do the procedure, send the patient back immediately to home with oral medications for few days.
Okay. Okay, so it's a safe procedure and it should be done under the certified dermatologist only because
Or plastic
people,
surgery.
yeah, okay, that's very interesting, doctor. So, doctor, like people also get worried about like for example, if a diabetic patient is losing the hair and doctor is saying them that you need to do hair transplant because none of the treatment will work on it. So, patient with heart problem or diabetes problem, can they go for a hair transplant? Is it
If it
safe
is
for them?
under control, so we,
Uh-huh.
first diabetes has to be under control. Usually, hair transplant is a procedure where young patients come, so we do not see this. Hypertension we do see in some patients, but the scenarios of diabetes, heart problems are very minimal in the practice. But
Mhm.
when that, then we have to get a clearance from the primary physician. Their medication has to be adjusted accordingly, and then only we can go for the procedure. And
Okay.
strict control of sugars and BP control has to be there. So even when we do the procedure, we check all that. And then only we
Mhm.
take up the patient. And in between also, we monitor the BP of the patient.
Okay. Okay, so if we go to a certified doctor, then the doctor will take care of everything, and when everything is controlled, then only the procedure will take
We
place.
choose the
Otherwise,
patient. Yeah.
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 Okay. Okay. So, doctor, in this era of so many information internet, where whenever we travel, we see in 1,000 rupees get your hair transplant done. So, what is actual like price, cost, or is it can it be done in 1,000 rupees?
Definitely no. So if you have to follow certain protocols, you have
Mm-hmm.
to follow certain things which has to be sterile, from the needle to the machine to everything you use, from the gauze, everything, that each has its own cost. And when you get the certified person who is doing it, or who is doing it done under their supervision, definitely that involves cost. So 1,000 rupees is definitely not possible at all.
Okay.
And you can't cover. And I also see people saying the number of follicles, even that I feel as a scam. As a dermatologist or plastic surgeon, mostly how we go is based on the stage of your problem. So you have stage 1, stage 2, you need a minimum number of grafts, but my aim has to be to cover the complete area. It's not that you have paid for me this number, so I take only that and leave the rest. I've seen patients coming with only one line filled and rest
Yeah.
of the areas unfilled, which looks ugly. So when you go to the right person, they assess the stage, and based on that, the charges will go. If it has to be done properly, minimum 65 to 1.5 is what generally charged, because that is the amount for the consumables and everything and the time, and has to be done in a proper clean minor OT setup, where you can't do every day 4-5 procedures and kept it unhygienic and do a procedure again, a hair transplant again. So you have to sterilize your OT as well. So everything goes with the cost. So it comes around 65 to 1.5, but there are people who charge up to 3 lakh based on their expertise.
Yes. Okay. Okay. So okay. So depending upon doctor to doctor, it can vary. But yeah. So the
It can
people who
vary.
are, yeah. Okay. That's very interesting, doctor. So doctor, like, what care can be taken after the hair transplant by the patient to maintain the hair? Like, is it like once the transplant is done, can they be like do whatever they done? And even people get scared ki kya pata, like if after hair transplant my hair will go away. So can you let us know some what is should be the maintenance plan for after the hair transplant?
Medications has to be strictly followed. So initial first 3 days, there are few strict protocols where we ask the patient not to lie supine. So like a little head and elevation we advise, and we ask them not to scratch, not to pick the scabs or anything. In my practice, what we do is third day we call the patient, remove the dressing, examine everything. Then we advise a mild cleanser. From fourth day onwards, patients can start taking a shower, but not standing directly under the shower, by using a mug and water in a mug, and then they can take the shower. And we ask them to avoid excessive sweating, vigorous exercise, exposure to severe sunlight, swimming, all this for up to 2 to 4 weeks. After 4 weeks, patient can resume their work, but then we give serums, which is usually minoxidil, which has to be restarted and has to be continued to maintain what is kept. We have put the hair there, but that has to be maintained. So definitely they will need. So some people think hair transplant is a substitute for medical management. No, it is done in people who do not respond to medical management. So the medical management then onwards has to be continued further.
Okay, okay,
And
that's
also
very
diet and stress management, all this has to be part. Finally, we keep the hair, but it has to grow, it has to take its own time. Usually you will see initially there will be a shedding phase. Only by 4 to 6 months they achieve a new proper hair growth. So in those time there has to be proper management as advised by the person who is doing the procedure.
okay, okay. That's very interesting, doctor. So, doctor, like there are dermatologists also, there are cosmetologists also. So, and then there is trichologist also. So, when to refer a trichologist, or we can go to anyone for hair transplant?
So dermatologist is the person who does 3 years degree and
Mm.
covers cosmetology, trichology, skin problems, and everything together. So it has
Okay.
to be somebody with MD, DNB, or diploma dermatology who does
Mhm.
the course for up to 3 years to get that degree, in which they learn everything in and out about the hair and skin. One another person who is expert in this field is MCH plastic surgeon,
Okay.
who are also well versed in the procedure part of it. So these are
Mm.
the two people. There is no just cosmetology, which is NMC recognized, nothing. It just has to go by dermatology or plastic surgeon.
Okay, okay, that's okay. So dermatologists are the trichologist only, and the or the plastic surgeon who can do the transplant. Okay, that's very interesting, doctor, because people get confused, like, कौन से doctor के पास जाना चाहिए? Okay, that's very interesting, doctor. So, another very common question is like, people get scared that, oh my God, the hair transplant surgery will hurt me. So, does the hair transplant procedure hurt?
We do give a local injection, which is a tiny needle we use. So that injection pain at that point can be there. Once we give the injection, the area becomes numb. It's not done under general anesthesia. It's done under local anesthesia. So only the injection pain for that moment will be there, which resolves in 15-20 minutes. The area gets numb. And then onwards, patient do not feel any discomfort. Post procedure, there can be a mild discomfort for which we give medicines. But it's not like any major procedure where they require inpatient or they require IV medication, nothing. Just a oral mild painkillers will do if patient has any discomfort, but which is usually not very common as well.
Okay, okay. So it's a safe treatment plan. It's just a little bit of tingling sensation, but it's all fine. Okay, that's very interesting, doctor. So, doctor, another very common question is like people actually get confused where how to choose clinic for a hair transplant. Like, should they go to saloon or should where should because there are so many clinic and so many saloons, so people get confused. So, how to choose a clinic for a hair transplant? Can you please
That's
let
what
us
I
know?
said. Whatever said and done, it is an
Yeah,
invasive procedure.
yeah.
We are going to give an injection, we are going to take the hair, we are going to put it in another place. There can be a little bit of bleeding. All this is going to happen as a part of any surgical procedure. So it has to be done under in a OT setup by dermatologist or plastic surgeon who are trained in the field, who do the procedures regularly.
Mm-hmm. Okay. So, doctor, finally, can you please give us some important tips for healthy hair?
First, diet, balanced diet, and do not get stressed out about your hair fall. That's going to make your hair fall worse. You feel your hair fall is a little abnormal, which is going more than 3 months. You find a patch, you find a recession of hairline. Go to a dermatologist, talk to them, find out what is the root cause. Do not follow randomly whatever comes. Do not follow any harsh, use any harsh chemicals or heating products. These are not going to help. Even the shampoos, hair oils, whichever mostly marketed saying before after, just use this for 2 months, 3 months. No, purpose of hair oil is just to give a good texture. Purpose of the shampoo is to cleanse your scalp. That is, the contact time is very minimal. It's not going to improve your hair. And also exercise, as I said, that is the most common problem now, which is a hormonal imbalance, especially in females. So good exercise and maintaining the weight will regularize your hormonal imbalance. And also sleep. Good sleep is very much essential. So majorly lifestyle changes, and do not smoke or alcohol, as it can worsen the pre-existing conditions. So these are the main things that has to be concentrated. And if you have a nutritional deficiency, meet the right doctor, get it corrected in an adequate way. So these are the few important things that has to be followed. And if you have a hair fall, don't sit and worry. Just go to a dermatologist, whomever you're comfortable, find the root cause and follow the management. Don't go with home remedies. These are not going to help and it might worsen also.
Okay. Okay, okay. That's very interesting, doctor. This discussion was very informative, and I'm sure our viewers have found the session very helpful. So, doctor, can I take one or two live audience question, please?
Yeah, sure.
Yeah, so the first question from our audience is, hi doctor, I have alopecia of grade 3 and none of the treatment is working for me. That means hair transplant is the solution for me.
Grade 3, I have to see why none of the treatments are working. So it is very unlikely that none of the treatments are working, because in grade 2, 3, definitely hair serum will work if given prescribed in the right quantity, right dosage, and if patient is taking it correctly, regularly. Next, PRP, GFC also do work. If everything has been tried and you do not have follicles in some area, it's completely bald. In that case, you have to go for hair transplant. In every hair loss in grade 1, grade 2, grade 3, hair transplant is not the only solution. So we have to find cause why it's not working. Probably you might have a nutritional deficiency associated. You might have some other issue associated. So we have to address that first. And then only we have to go for hair transplant.
Okay. Okay, that's interesting. Another question from our audience is, hi doctor, my father used to lose hair and now he's bald, and now I'm at age of 30 and I'm also losing the hair. And do you think that this is genetic? And if it is, can I get your appointment? I also stay in Chennai.
Yeah, definitely we can see you. So I work at Cosmetic Hair Transplant Skin Clinic, which is in Kodambakkam. You can Google. or you can call us. But the thing is, if your father have, yeah, your chances of getting baldness is very high. But
Mm,
as I said, if it's a normal hair fall, 50 to 100 hair per day, there is no recession of line. Your bald scalp is not visible. In
mm,
that case, we do not call it as baldness. We do a
okay.
trachoscopic examination using the scope, see if there is any thinning of hair.
Mm,
Only if these things are present, then we call it as baldness pattern. Then only you will need a treatment. When there is a family history, there is a higher chances of you getting, but not everyone gets. So it has to be seen.
okay. Okay. So please go to the doctor. You can take her appointment. I'll just quickly take one more question from our audience. She's asking, Doctor, I am at a menopausal age, and someone told me that hormone therapy can let your hair grow back. Is it true?
So just for the hair fall, again, hormonal therapy is not required. If
Mm-hmm.
your hair loss is due to the, as such, with the age, the number of follicles reduces. So the hair fall, like you say, when you're young, you lose 100 hair, you might get back 90 to 95. When you go a little older, it might be less. So we have to evaluate, see if it is a normal hair loss. Your
Mm-hmm.
follicles are intact, you don't have recession of hair. If the hair fall is just due to menopause, you have attained menopause recently, then menopause and that stress itself can cause 2 to 3 months of hair loss. Menopause, there can be a nutritional deficiency, there can be other issues. If none of this is present, and if it's a pattern hair loss, yeah, hair serums can work, or if required, PRP, GFC, or maybe in females, if it's very mild, we do not directly jump for hair transplant. We do
Mm-hmm.
try the medical treatments, and if
Mm-hmm.
medical treatments are not working, then we have to talk about what is what.
Okay, doctor. So, doctor, would you like to give any take-home message or any final suggestion to our viewers today?
So yeah, hair care. Keep your hair care very simple. Don't get confused. Don't, because most of the issues happen when you try to overdo. So
Mm,
identify, you have a hair fall, try to identify, is it a normal process? Hair has to fall to grow back. So not every hair fall has to be addressed. Not every hair fall requires treatment like other person is doing. Their problem might be completely different than yours. So
mm,
try to see what is the root cause. When you're confused, go to a dermatologist, get a consultation, see what is happening with your hair, and then correct the factors, identify the cause, and get the treatment according to the cause.
mm.
Because not like one treatment works for all. It has to be tailored to the patient concern and the issue they have. And also, yeah, definitely affordability. Not everyone can go ahead and do a hair transplant. So without hair transplant, without PRP, GFC, are there treatments? Yes, we do have. So try
Mm.
to find what works for you and then get it done.
Yes, doctor rightly said that early intervention is always a solution, and getting frustrated at home using the home remedy and then coming to the doctor is both frustration for both the doctor and the patient. So it's always better that we go to the doctor on time. Thank you so much, doctor, for sharing all your expertise and advice with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very beneficial. And that, thank you so much, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you. Thank you for the, it was nice having a conversation. Thank you so much.
And if thank you so much, viewers, for joining us today. And if our doctor has some time in future, we can burst more myth and facts around hair care. Until then,
Definitely.
doctor,
Yeah, we'll do that.
please do take care of yourself, and happy New Year and Merry Christmas in advance.
Happy New Year to you too. Take care.
Okay.
Bye.
Okay. Bye bye.